And then, go ahead, Marissa, take it away.
All right. Thank you so much, Marissa. So that was, it's always a little funky to listen to your own bio, but thank you so much. I really appreciate it. And it is an honor to be here, you know, especially with Black Breastfeeding, Chest Feeding Week happening. So thank you for having me. And yeah, I'm going to get us set up. So just bear with me for a second. I'm going to get PowerPoint up for you. Oh, hold on. And, okay. All right. Are we good here? Does everybody see the screen if you are watching? So we're going to dive into lactation and cannabis. And this is a topic that is, you know, the information that we have so far is definitely, it's starting to trickle in. We have a lot more anecdotal evidence than we do have, you know, confirmed, confirmed data. That just means we have a lot more, you know, lactating, breastfeeding, chest feeding people who are reporting their cannabis use. And then there's a lot more observational studies and research happening based on those reports. So we're going to get into the topic and just, you know, we'll go from there. If anybody has any questions, I can actually see you with this view. So please feel free to raise your hand. And I'm happy to, you know, I really want you to be comfortable here and free to speak if something comes up for you. So please just let me know. Marissa did give me that lovely introduction, but succinctly, I'm a cannabis care nurse, educator, and author. So I started in the cannabis space almost about 7 years ago. I am a registered nurse and I was working in a psych behavioral home care, and I had patients who were using cannabis and they all had cannabis use disorder as diagnoses, but I did notice that there was something to it, them using cannabis. A lot of these people were experiencing, you know, well, exhibiting signs of, you know, recovery. They were staying compliant with their programs. They were, you know, they were just basically, you know, improving their quality of life. And so that was something that sort of led me to the medical cannabis space that was just started here back in 2015. And I've been involved ever since. So my background prior to that, I'm a prenatal yoga teacher and massage therapist. I've always been in the supportive role in terms of, you know, maternal health. When I went into nursing school, I really wanted to be a labor and delivery nurse. And at the time when I graduated, there were absolutely no jobs in that sphere. You really had to, I literally had a nurse on one of my clinical rotations tell me that, you know, you have to wait till someone dies on an L&D unit in order to get a job. So I had to move on, and I ended up in a different part of the healthcare field. So I am a prenatal yoga teacher. I have taught lots and lots of mommies how to prepare their body for birth and beyond. And I also, prior to that, I've been a massage therapist for over 20 years now, and I have worked with a lot of pregnant and postnatal people. I trained birth doula. I was a volunteer doula for a hospital here in Massachusetts. That was a very interesting experience. I did not do private doula work afterwards. I really just wanted to get involved in the volunteer space. I did that for about a year. And I really learned that hospital birthing is actually not where I wanted to end up in my career. I am a maternal health and birth justice advocate, as you could probably figure out. And because of my feelings and my own experience with my first baby, I became a home birth mama, really wanting to birth in my own way. And I was fortunate enough to find a wonderful midwife and doula team that took me on when I was 28 weeks along and decided to fire my OBGYN. And I am I'm a retired exclusive breastfeeding mama. This is a picture of me with my youngest, and I breastfed for a total of 60 months. So I completely get where you may be in your journey. In this presentation, we're going to first have a succinct meditation. We're going to do some ground, shield, and protect work. That's just going to set the stage for this larger conversation, and really help us, root down and get into the right framework where we feel comfortable. This is, in my mind, in my estimation, a sacred space. So let's all honor that for ourselves and each other. Then we'll talk about cannabis and human milk, and what the literature has to say. And there's not a whole lot. I really focused on one study because I think that's the most important feature. There are other studies, and what I will tell you in the literature is that we have a big inconclusive question mark on a lot of the current data surrounding perinatal cannabis exposure and the fetus, newborn, infant, baby, child. And then we're going to briefly talk about the role of the endocannabinoid system in newborn suckling, which is really fascinating stuff. And then we'll talk about the impact of cannabis stigma on parents. You may have experienced some degree of that, and we're going to talk about the social implications, the legal implications. We're going to talk about a lot of the experiences that we've had as parents who use cannabis and dare to be open about it. And then I'm going to leave open space for questions and sharing throughout. So again, if you do, I can see you. So if you do have a question, something comes up for you, please feel free to let me know. All right, mamas, or parents. Do we have mainly mamas here, parents? I usually call out mamas, but I do want to be really respectful of everybody's identity. So how about we'll just call ourselves parents. Okay, ground, shield, and protect. So it's really important that we ground and shield ourselves before doing any sort of deep investigative work like this, and any form of meditation in that regard. So if you're in a quiet place, or even if you're not in a quiet place, perhaps you can sit up really nice and tall and really allow your buttocks to really just deepen down into whatever surface you're sitting on. If you're standing, you can do this with your feet. You can really press your feet into the floor, into the ground. Good, settle there. And we're going to focus on the breath as it flows in and out of the nose now. So you're going to start to root down. And as you do that, you're going to bring your focus up into the breath. And you can close your eyes if it serves you, or keep them open. Or you can look at this beautiful image that I've provided, the tree of life, the sun and the moon peeking through the branches, the moon really being protective and overseeing. That beautiful visual. Let's go ahead and breathe in now deep to the belly. Really allow the belly to expand and soften. Breathe in as far as you can, expand as far as you can. And then when you've taken enough breath, go ahead and exhale everything out. The belly relaxes, the muscles relax. How about 2 more times? Go ahead and inhale, really fill up the belly. Expand fully. Take 1 more sip of breath. Exhale everything out. The muscles soften, everything comes back to the midline. We'll take 1 more nice deep inhale into the base of your belly. How about into your navel center? Breathe up into your heart center, up to your collarbones. Take 1 more sip of breath all the way up past your head, through your crown chakra. Exhale everything out. Relax, let it go. Come back here. And good. And now you can just visualize here that beautiful golden setting sun behind the tree. that light and that heat and that beauty. Allow it to envelope you from the roots that you've now developed under your bottom or your feet. Let it shine out 10 feet away from your body in all directions. Go way up past the crown of your head and all the way back past your sacral bone, back down to your heels. This light energy brings in the positive that you need. And it protects against any of the negative that you don't. The warmth will help you stay calm, stay relaxed, stay soothed. And the light will repel any darkness. It will illuminate anything in the dark. It will allow you to see it clearly. It will enlighten us as we journey through this presentation. Good. Okay, so we're gonna dive in here. So about the data on this topic. Well, like I said, the studies conducted regarding cannabis use during pregnancy, breastfeeding, chest feeding, and parenting, really, they all tend to conflict. So most reported negative impacts are reduced or eliminated when confounded for low socioeconomic status and concurrent use of other substances such as tobacco, alcohol, cocaine, abused prescribed meds, and even just, prescribed meds in general. So there's a lot of confounders. Basically what this translates to is that when we tease out all of these other factors out of the data, it's really hard to say that, yes, absolutely, cannabis use during these periods produces XYZ effect. And a lot of times that XYZ effect has to do with neurodevelopment of the child and infant. And most of the studies are really skewed. They focus on cannabis smoking and specifically THC. We know that there's 150 identified cannabinoids now and counting. So focusing on one psychoactive one is kind of, it's a bit silly. There are other countries that are doing a lot more diverse research. Here, of course, in order to do a cannabis research study, up until very recently, you would need to have been seeking a conclusion of harm in your literature, so in your research. So now we're starting to see a shift, but a lot of these themes definitely play out in the current literature. And most of the studies are retrospective cohort or self-reported, and the problem with that is that people may not, the retrospective cohort is basically taking data points. So you're looking for, say, maternal health or maternal cannabis use, and then you're going to look for autism. And so there's a lot that you can infer from those two data points. And then it's also, you can really create any conclusion that you want. And so we have a lot of skewed data in that sense. And then the self-reported stuff, well, we all know that this is a really controversial, it's a controversial topic. Cannabis use during pregnancy, breastfeeding, chest feeding, parenting is all controversial. And because of that, because we all know that there's social and legal implications, chances are those self-reports are not going to be necessarily as accurate as they could be. So this is a quote from the American Academy of Pediatrics. Marissa asked me to focus on breastfeeding, so we're going to do that. And this is what they came out with a few years ago in 2019. So, and I call that now the pre-COVID era because a lot of things have changed for us. So what we're saying is that we're concerned about marijuana exposure during pregnancy and breastfeeding because there may be some adverse neurologic outcomes. So that may be some adverse neurologic outcomes. That's an important piece. But at this point, we're not saying, no, you can't breastfeed because there are so many positive effects of breastfeeding on both the mother and the baby. So the American Academy of Pediatrics does understand that very often the benefits of breastfeeding, chest feeding, giving an infant or child human milk those benefits greatly outweigh the possible exposure they may have from certain substances. All right, so this was an important study. It's a small sample, but it really did provide a lot of information. And I do want to give props to an organization that is based out in Colorado, because this information is where I grabbed from. They really were essential in bringing this data to life. That is Elephant Circle. They are a birth justice organization. I believe Marissa is affiliated or knows them. And maybe possibly all you mamas or parents know them as well. But they really helped to conduct this study, and this is what they found. The important details on this study focused on transfer of inhaled cannabis into human breast milk. The important details here. The goal of this study was to evaluate the transfer of a few different cannabinoids and their metabolites. Delta-9 THC, otherwise known as THC, 11-OH-THC, and then COOH-THC. And those are metabolites of THC. So once THC is ingested, it goes through the liver, and it's broken down into these metabolites. COOH-THC is actually the metabolite that they test for in tox screening, in drug screening. So they're not testing for Delta-9 THC, they're actually testing for that metabolite. They used in this study, they used one specific type of cultivar or strain, cannabis flower. These women all smoked the cannabis, and they were given 1/10 of a gram of presidential Kush. So the single dose was thought to be worth 23 milligrams of THC. They consumed it on an unused glass pipe. So the researchers evaluated the milk prior to cannabis consumption. They asked the women to abstain from cannabis use for 24 hours prior to participating. The babies were all term babies. They were exclusively breastfed, and they were ages 1 to 6 months old. All these women were cannabis users, and they were able to pump and not nurse the baby for 6 hours while participating. Four had reported that they used cannabis infrequently, so they didn't use it every day, and one had reported that they used it 7 to 10 times in the past week. The other participants were daily users. They evaluated that milk prior to cannabis consumption at 20 minutes, 1 hour, 2 hours, and 4 hours after smoking a single dose of the cannabis. The findings, the key takeaways here, was they found that the bioavailability, or the amount of THC that gets into the body when smoked, is somewhere between 5 and 50%. And that bioavailability is variable because of multiple factors. Everybody has a different metabolism. We all, you look at different body types. Some of us, really don't metabolize quickly. Some metabolize really slowly. Some metabolize incredibly quickly. So all of these factors play into how we break down substances, including THC in our body. We do know that THC bioavailability is really poor when it's consumed by mouth, and that has to do with how our liver breaks it down and metabolizes it. It's up to 95% of THC is metabolized by the liver, which only leaves 1 to 5% available for. So this is in relation to a mom smoking cannabis, and then how it transfers into her baby via breast milk. So we do know that there was, at best, 1 to 5% of that THC left in mom's body that was available to transfer to baby. So they found that an exclusively breastfeeding infant ingests about an estimated dose of 2.5% of the maternal dose. And of that 2.5%, only 1 to 5% is biologically available to the baby orally. So this is, it's interesting in the sense that we do know it transfers over, and we also know that very little of it actually transfers over to the baby. I did want to speak for a second about when they tested. They noted that there were no measurements taken between 20 and 60 minutes because human milk would be hard to pump at 20, 40, and 60 minutes. So the peak levels that they found happened at an hour. So the highest rate of THC was in the breast milk at an hour. And then that rate of THC, it really declined over the next 4 hours. By hour 4, most of the participants in the study, their THC levels in breast milk were at baseline, meaning that they were almost negligible. And another thing regarding bioavailability, just to give you the idea of this variability impact, is the subject who reported the highest use of cannabis, 7 to 10 times in the past week. They did not have any detectable THC at baseline. So they abstained for that 24 hours, and there was none, really a negligible amount found in their system at the start of the study. So the relative infant dose of cannabis is, this is the calculation for it. I'm not going to go too heavy into that, but they did find that, so the lactation risk, these websites and these organizations that help to create guidelines around dosing for medications, what's safe during pregnancy, breastfeeding, all of that, they indicated that when an RID, or relevant infant dose, is less than 10%, it's considered safe to use while breastfeeding. The RID of cannabis is 2.5%. So this brings me to my next point, though. Lack of confirmed risk is not a concession of safety. And that's something that I say all the time when I'm interacting with parents in the cannabis space. We do have to be very mindful that just because we're not demonstrating, certain risks in the literature, and we're maybe not be seeing it so much in the community, it doesn't mean that, it's the best decision. That being said, every family deserves the right to weigh risks and benefits and make decisions, informed decisions that work best for them. And that is one problem that we have with this controversial topic and substance, is people are consistently denied their rights because of the federal prohibition related to cannabis. And what is the main concern in cannabis exposure? Well, it has to do with neurodevelopment. And we do know in certain studies that are conducted, one of a big scientist here, Dr. Stacy Gruber, she conducts research out of McLean Hospital, and a lot of her research centers on adolescents. And we do know that cannabis exposure for adolescents is not great. It can impact the development of the prefrontal cortex, which can, result in people, growing up and not being able to make decisions very well, having, limited executive functioning. So these are certainly things that we need to be considering when we are, exposing our kids, or our kids are exposing themselves to cannabis. So we'll talk about the ECS role in postnatal suckling, which is really cool. We talk in a lot of cases, if you're on social media and you're in these pro-canna mom groups, parent groups, you will see people say that, cannabinoids are in breast milk. And that is absolutely true. There are cannabinoids in breast milk, but your breast milk is not the human milk, sorry. I am really working on my language here. Human milk is not full of the phytocannabinoids or plant-based cannabinoids that we would see in cannabis plants. So you're not going to have THC and CBD in your human milk. But we do know that you have 2-AG, and that 2-AG is the most second well-known endocannabinoid in our body. And anandamide is the most well-known one, that's known as the bliss molecule. So that's the one that, when you have THC on board, it interacts with your cannabinoid 1 receptor, and it, your body sort of upregulates and gives you this nice, happy feeling. Well, that's anandamide really, really starting to flow into the system. So we know with postnatal suckling, though, that the CB1 receptor activates by 2-HE, and it appears to play a critical role in the initiation of milk suckling. This study, though, had to do with mouse pups. So what we want to find out is, could cannabis possibly play a role in helping parents who are struggling to initiate lactation and human milk feeding? That these are questions that we certainly want to know, because we do know that it plays a critical role in these babies, the mouse pups, being able to start or initiate breastfeeding. Freed, this is a slide that I just brought over. She is a researcher that passed away, but she did a lot of this incredible work in Israel, and I highly recommend reading her research if you have a chance. It is science heavy, but there's also been a lot of support articles on it. So a little bit of research can help you to understand what she was looking at. And she found that perinatal manipulation of the ECS by administering cannabinoids or by maternal marijuana consumption alters neurotransmitter and behavioral functions in the offspring. So all of this means is that her research did confirm that there's certainly an impact to the body when it's exposed to cannabinoids. All right, so hopping right along, we're going to talk about some of the social and legal implications of perinatal cannabis use. As I'm sure we all well know, there are state public health departments, professional societies that convey the guidelines and recommendations in regard to prenatal cannabis use. And these guidelines and these recommendations are used by hospitals and medical centers and birth centers that receive federal funding to create policy around maternal and parenting drug screening. So there's a range of consequences for cannabis consuming families. They may be at risk of punitive consequences due to social worker health provider bias opinion. Most social workers and health providers in the country are mandated reporters. So, and with federally listed substances, if a health provider comes across a family who has positive for a federally listed substance, then that reporter is supposed to send a report to the appropriate agency to conduct an interview and investigation to ensure that the child involved is safe and that there's no abuse or neglect on board. The problem with this is that, we do know that most cases where mandated reporters, especially when it's just cannabis use, these cases go unsubstantiated. There's very few cases are actually substantiated for neglect and abuse. So basically what that means, in my estimation and other people's estimation, is that it's a big waste of money for these agencies to go about and sort of interfere with a family that has just had a newborn, and get involved in a family that's trying to learn how to adapt and just manage the life of this new person. It can be really harmful, and it can be really traumatic. And if anybody here has experienced that, I'm happy to discuss that a little bit down the line. So the consequences, as many of us likely know here, children may be removed in cases of substantiated abuse and neglect. We see that more in states that don't have legal programs, or states that have really narrow or limited medical programs. And then the southern states are certainly, we see a lot more of that happen. And then criminal drug charges and prosecution are possible. Again, we see that a whole lot more in states that don't have decrim laws, don't have medical or legalization laws. And it's just important note here, the BIPOC are at greater risk of being reported and suffer more severe consequences than white people with similar use of substances. It's a horrible reality, but it is absolutely a reality. All right, legal and social consequences post-birth. Well, Child Protective Services may open that investigation, interview the family, conduct surprise visits. The case may be closed if signs of abuse or neglect are unsubstantiated by a licensed social worker. Postpartum families frequently report negative impacts from CPS intervention. Drug screen of mother-baby pair is done without consent so many times. It's not good. And I do say that if you are a pregnant person right now, if you're about to go on this journey, it's really essential that you know your rights, and there are resources for you so that you can really understand your rights. And there are resources that I can provide also to your partner or whoever will be assisting you during your birthing process, so that they may be prepared should you lose the ability to advocate for yourself during birth. Birth is one of these periods in where birthing people, they just, because of the nature of birth, there is a point where a lot of people are affected by this almost suspension of their rights, and a real there's a lot of issues here. That could be a whole different presentation in itself. We're going to talk here about the interruption of the golden hour because this really relates to breastfeeding. We do know that complete disruption of breastfeeding when mother and or baby screen positive for metabolites of THC does happen. And that is so wrong because we know that the golden hour it's a set of evidence-based practices that contribute to the physiologic stabilization of the parent-baby dyad after birth. What does that mean? Well, it means that this hour is necessary for the baby to establish their own ability to regulate their temperature, decrease their stress after they've been born, after, start the bonding process. Important elements of the golden hour include delayed cord clamping, skin-to-skin contact for at least an hour, the performance of the newborn assessments on the parent abdomen, delaying non-urgent tasks such as bathing the newborn for at least an hour, if not longer, and then the early initiation of human milk feeding. So all of these things are essential for really helping the parent-baby dyad get onto the right foot. And implementation of these actions is further associated with increased rates and duration of human milk feeding. But when the golden hour is interrupted, we do know that there are significant consequences for that. And this does happen. And a lot of times this is because of healthcare provider bias. That person is a mandated reporter. They go and register, the report and say that, CPS now needs to come in and investigate. And at the same time, they may take it upon themselves to go in and interfere with the initiation of these processes simply because of their bias and what they think they're doing. But they're completely denying the data here. They're completely denying the evidence because we know that there are risks associated with interrupting the golden hour. Parents who do not have immediate skin-to-skin post-birth were found to be twice as likely to experience postpartum hemorrhage than parents who did have skin-to-skin contact and initiated human milk breastfeeding. We know that initiating human milk feeding is essential to stimulate the uterus to release oxytocin and to contract back to its post-birth shape. So, and that is what that post-birth shape for the uterus is what's essential to stop bleeding, to prevent that hemorrhage. We also know that these parents are at a much greater risk of developing infection if their body isn't allowed to go through these natural processes where that contraction happens in a timely manner. And we know that the benefits of the golden hour far outweigh the risk of intervention. So therefore, it's reasonable to consider that interruption of bonding, human breastfeeding due to a positive drug screen promotes more harm to the parent newborn diet than not. After that, I would love to open up questions and discussion. And I just wanted to say thank you so much for having me. My payset did talk about my blog, which is holisticnursemama.com. I haven't been too active on there because I'm also building this company where I'm educating cannabis industry professionals and healthcare professionals with my company It's All Education. It's myself, and I have a wonderful team with me, a certified nurse midwife named Julie Battle. Some of you, if you follow in this space, you're probably aware of Julie. And then we also have another partner named Caitlin Bernhard, who is a women's health, she's a family nurse practitioner, herbalist, and a women's health specialist. So I'm going to stop the share and I'm going to come into the room, and I would love to talk and answer any questions and anything that comes up for you. Please feel free to let me know.
Well, while everyone is thinking, I do have a question.
Go for it.
Can you explain further about the significance of cannabinoids and some of those different, what makes it different in like I know it, like nervous system, cannabinoids, like what is the marriage between all of that?
Okay, so we know, we've known for 30 years now that every human being has a physiological or functional system in their body called the endocannabinoid system. And that's in our culture, in the canna culture, it's usually called the ECS. So this system was discovered because scientists, a woman, Dr. Ellen Howlett, and also Dr. Raphael Mechoulam recognized that cannabis was producing an effect in the body, but it wasn't happening in the parts of the body that were already discovered, like the nervous system. It was happening related to the nervous system, but there was something else going on. So we know that cannabinoids sort of integrate or they affect a variety of receptors in our brains and bodies. So the endocannabinoid system is the largest neuroregulatory system in our body. So it is a master sort of helping the body maintain balance, or a process called homeostasis. Our bodies are constantly changing, constantly in flux. We're constantly doing different things. We're digesting, we're breathing, we're doing all of these sorts of things. And so basically the ECS is our checks and balance system. We know that cannabis evolved with mammals over the millennia. We know that cannabis is sort of an essential, I believe, and it's starting to happen. I truly believe that cannabinoids are a nutrient. Cannabis and hemp in general are nutritive plants. We do know that there's a lot of diseases that have sort of become a real chronic epidemic problem in our culture. And when we look back to when cannabis and cannabinoids were sort of in our systems on a regular basis, we didn't see high rates of things like autism. We didn't see rates of other sort of inflammation-based diseases. So that's, I hope I answered your question well.
You did. I'm such a geek. I'm like gonna look all of that up.
Yeah. We do know from the autism community that there's a lot to be said for a lot of families are plugging in not like THC, but like CBD and even hemp-based foods and they see a huge difference in their kid, or they see a huge difference in their family member. And we used to have cannabinoids were a major part of our dietary system until about the 1940s, from millennia. So.
Does anyone else have any questions? Thank you so much for answering that, because it's so important for us to know truly what our body makeup is.
Mm-hmm.
And so much of what we're taught in school is for a purpose that's outside of us really knowing ourselves.
Yeah.
So, I love that. Does anyone else have any questions? Because I'd love to. Also, I have a giveaway. I forgot about this. Is anyone in the Denver area? Raise your hand if you're in the Denver area. Or, if you're in the Springs and you want to come to Denver, absolutely as well. Is anyone in Denver? Going once, going twice?
Mm-hmm.
Well, I had some tickets that I wanted to give away to the Meow Wolf Museum.
Mm-hmm.
And if there's anyone that would like those tickets and could pick a number between, okay, Shelby, I got 5 tickets. If anyone wants to put in on this giveaway, you just need to pick a number between 1 and 15, and Marissa, you can pick the number.
Okay.
So be thinking about your number.
Mm-hmm.
And before we go ahead and make that virtual drawing, does anyone else have any questions?
Marpesa, I do have a question.
Yes,
You
ma'am.
guys, I'm gonna step outside really quickly. Sorry, everyone. I just picked my little ones up from school, so that transition.
No worries.
I do have a question. So I think my biggest question and what I struggle with, I think the Elephant Circle has been an amazing resource, but what advice would you have for folks that do test positive and they are within the hospital and they are getting threatened about nursing their baby, like even beyond the golden hour? I supported one family, and with their first birth, they just went through so many things. Child Protective Services were called in, and they opened up a DHS case on them, and it eventually got dismissed. And so from other trainings that I've done and other folks' advice have been like, not throwing away diapers inside of the trash can if they know that they've been, smoking or taking edibles or whatever, if they know that they would test positive, basically, just being mindful of their baby's diapers, not allowing them to test the cord and things like that. But do you have any other advice or any other tools that we can use? Because realistically, most of my clients and their families, they are testing positive for cannabis.
Yeah, it's a great question. So there's basically, it comes down to families need to really understand their rights. And we have rights in a hospital. Just because you're a birthing human doesn't mean that you all of a sudden have lost all of your rights as a human being. You don't suspend your civil liberties or your human rights to be a birthing person. Unfortunately, what has happened in the really broken medical system is we have this patriarchal influence where they think that they can just, ignore your rights as a human being. And it's not right. So there's a guide that was put out by the National Alliance for Pregnant Women, and it's about birth rights, and that is available via download PDF. I can go find it, or maybe Marpesa, do you have access to it? I'm trying to. And then the other thing too is just to really know your rights going in, and then we do have the right to refuse any drug testing. We have the right to refuse, you have the right to refuse as a parent in any other way. You have a right to refuse, that, what your child takes, what happens to your child. So that shouldn't be any different directly post-birth. And then the other piece of it is just, if you are a birth worker, it's about educating people who are really invested in the stigma and, all of these really harmful processes. It's an uphill battle, but we're starting to make inroads in terms of like, look, why is it okay for you to interrupt this family at the beginning? That this period of time, from the time a baby is born until they go home and beyond, I mean, that family has to bond, they have to endure sort of a survival mode. They're going to go through this huge transition. And it doesn't, thank you, Marissa, and it does not, there's nothing, there's no real great evidence to support this intervention, this intrusion. So I recently talked to an advocate here in the Boston area, and she's a Black woman, and I asked her, like, how did you stay out of the crosshairs? And she goes, I just told them, and my husband told them as loudly as we could over and over again, that if they intervene with us and they do this, our name's going to be on the hospital. That's what we kept saying. We just kept saying that our name is going to be on this hospital. We won't own this hospital, and I don't know. I think maybe perhaps, and I don't know if this is not the best advice that I could give. I feel it's just a story, but I do think that perhaps that's what we've gotten to, is you need to start talking in a language, or we need to start talking in a language that these people will understand. No, you don't get to cross this boundary. You don't get to interrupt these processes that you don't get to negatively impact our family potentially for the rest of their lives, so that you can have your report and and stay within the, stay on the up and up of your responsibilities, so.
Thank you.
Yeah, on the National Advocates for Pregnant Women.
Is that the right one? I didn't see Alliance, but is that it?
It might have changed that to Advocate.
When I typed in Alliance.
Yeah, it's Advocates. And then
Okay.
here, under their, I believe it's their resources, publications.
Well, while Marissa's looking that up, if you would like to put your number in the chat, 1 through 15. Speak now or forever hold your peace. Also, Marissa, I just want to speak up on Shelby. She's amazing. Our lactation educator, 4 doulas, 4 parents.
Wow.
Mom of 4, new baby. Just a whole bit. So
thank you for all you
glad she
do.
was on the call.
I love you, Marissa.
I love you too.
Oh,
Well, it looks like you're the only one, so you'll get the tickets. You deserve them.
Let me go. Hold on. I know where I can grab the link. I am also, so I have a Facebook group. We're of course a pro Canna Mama group. We do it is for mamas. We get asked all the time, when are you going to start a parent one? We just haven't gotten there yet. So we talk a lot about birth trauma. And basically it comes down to, do you have a person who calls you mom? That's what we look for. I know that I put this in here somewhere. And if not, I can certainly get it to you.
Yeah, absolutely. Yeah, if there's any other resources later on that you want to send my way for our doulas, that would be amazing.
Yeah.
But I really appreciate you being here. I don't want to go. We're at time, but I appreciate this a lot. Like Shelby was saying, this is a thing. And
Mhm.
if we have anything to do about it, 2022 and on, it won't be, we'll be equipped and be able to empower our families in a way that we hadn't thought about in the past, that we were feeling really helpless about it.
Yeah, and it is, and it's a helpless state. And I certainly, I landed there. Oh, I don't want to be mindful of time. Is everybody cool? Or
Yeah, I was more so considering your time, but
oh no, I'm good. No, I landed here because I was working in the dispensary, and I had a patient come in, and she was obviously pregnant, and I just didn't know. I didn't know what the right answer was. And then I saw her be mistreated by some of the male workers that I worked with. And I'm like, no, you can't do that. And they're like, well, like, she's an adult and she can make the decisions for herself. And someone gave her a medical card. I was like, so no. I was like, you, with your retail experience, don't have any right to interfere in her decision or what she buys. I was like, what we do need to know is, how is that impacting a person like her? And how do we help them and support them and give them the information they need to make informed decisions so that they aren't negatively impacted? And that's what it comes down to is, we are seeing too many families be negatively impacted because they are using cannabis, and there's not enough information to confirm that that's okay, according to the leaders in the field. And then therefore they are treated punitively with great prejudice and stigma. And then it just perpetuates, you're downloading all this trauma into their family. I've talked to a mom who had this experience 2 years ago, and she had to go into the hospital because it caused her such a horrible postpartum depression. This is a mama who had 5 kids. So her last baby, she said she couldn't stop throwing up. She started using cannabis because she was so sick. And so she popped positive, and they didn't tell her anything in the hospital. They said, she didn't know. They went home. She went home. And 2 days later, she got a knock on the door. And so think about it. Mom with 4 other kids, newborn baby. It's COVID. So it's really weird. Nobody had been in her house for months because of COVID. And all of a sudden, the social worker is at her door saying that she needs to come in and see the environment and make sure that the children are okay and that she'll be back, in a couple hours. It threw her into, she said, a postpartum anxiety state that quickly progressed to depression that she couldn't kick. And it affected her ability to bond with her baby. It affected her ability to be present with her children. She said it just made her feel unsafe in her own home. And I think, why? What is the purpose of that? So, and in the end, nothing happened. So,
yeah, I always say that people have to keep their jobs.
they do, yeah.
The justice system needs to keep their jobs. Doctors need to keep their jobs. Like, police need to keep their jobs. Like, just report after report after report without thorough universal rubric, or just what outcome are you looking for, other than sometimes what feels like quota, is a problem.
Yeah. It's just, we got so many broken systems, That's all we're doing is these, all of this stuff is just enabling broken systems.
Mhm.
We know that, treating people that have a substance abuse or addiction problem in a punitive way with the judicial system and not the healthcare system it doesn't work. It's expensive. I mean, we've got 2 million people in prison. I don't know what the exact number is for drug offenses, but it's insane. And we're carrying the cost for all these people.
Mhm.
It just doesn't make sense. It really doesn't. But yeah, people do need to stay employed, and that's why these systems continue.
Man, things are changing.
Things are changing, yeah, but people like us, we're
Mhm.
gonna change it. We only get a short spin here, so how are you gonna write your chapter? And hopefully it leads to, better things for the next person.
That's right.
You know, I will say, I am a mom whose children were exposed to cannabis. I didn't learn I was pregnant until both kids were, 10 weeks along gestation, so almost through the first trimester. When I found out, I stopped. It was the best decision for me. Doesn't work for everyone. And then my babies were both exposed to cannabis via breast milk. One at 11 months and one at 14 months. And it wasn't like I was puffing on a joint with the baby at the boob. I was treating symptoms of depression, anxiety, and insomnia and pain, with tinctures and topicals and things like that.
Yeah.
Yes.
Question.
Yeah, I know that we're at the end and I don't want to take up too much time, but one thing that I always find so interesting when we talk about these topics or, I know that like just going to different conferences that talk about this, it always blows my mind because as lactation support, we're taught like for harder drugs, when we're talking about like meth and crack cocaine and even alcohol, if it's been exposed inside of the womb, that it's not in the baby's best interest to stop cold turkey. So they're actually encouraging the birther to have their baby suckle because it will give them, basically, their need so that their bodies don't crash from getting a hard detox from these drugs.
Yep.
So I always wonder with cannabis, and then, I mean, I know that studies are not completely accurate, but there are studies out there that show that if a birther intakes cannabis at any time after 6 weeks, I mean, up until 6 weeks. So let's say that, I'm pregnant right now. I don't even know I'm pregnant. I'm 6 weeks pregnant. I find out at 9 weeks, I completely stop. It will still show up in my placenta. So it's amazing to me. And I think just the lack of research as well is a thing. But yeah, I always find that so interesting that with more like what we would call street drugs, hard drugs, it's encouraged to lactate. But when cannabis comes in the picture, it's like stop immediately.
Yeah, it doesn't make a whole lot of sense. And yeah, we do. I mean, we have an epidemic of neonatal abstinence syndrome, where babies are exposed to opioids and other substances, and they're in withdrawal when they're born. That's horrible, and it's just there is a lot to be said. Yeah, if you're a daily cannabis user, and then all of a sudden, I mean, I have talked to mamas who are, they try to stop cannabis. And a mama that had MS and she wasn't supposed to get pregnant. She got pregnant. And she's like, she goes, everybody told me it wasn't possible. And she goes, here I am. And she goes, now they're like, she goes, I'm on all these meds that are like questionable for maintaining my condition. And they're all focused on getting me off of the cannabis. She goes, it doesn't make any sense to me. She goes, the cannabis is my glue. It's what keeps me functional. And so she's advocated for herself and she had, a healthy baby and, she had to work with people who were basically like, well, you're going to pop positive and this is what's going to happen. And she goes, oh, all right, I know it. She goes, but these are the things I'm going to do. I want to breastfeed my baby, And so perhaps that's another approach too. It's like, okay, I know that this is what's going to happen, but this is what I'm going to do. And, just keep those conversations open. Yeah, there's a lot that doesn't make sense. And it really does come down to, cannabis has always been, the laws were literally developed around cannabis prohibition so that the government had the ability to go after communities of people of color. That's why cannabis prohibition happened. The other piece of it was so that the industrialists who were all making synthetics could, tamp out hemp, because hemp can be a superior natural plant that does compete strongly against all of the synthetics. So it really, it came in through cannabis prohibition was fully corrupt from those two angles and others. But yeah, it's just perpetuates. It's just so that, the system can negatively impact groups of people of color, women. We're always on that chopping block. But we can make a difference. We're making a difference now. This is making a difference. And the reason why I'm honest with my kids being exposed is I just want to say I know a lot of canna babies. I know a lot of canna babies, and I'm not seeing it. I'm not seeing where are these deficits? Where are these kids? Like, I'm sorry. You can't tell me that kids that live on screens, eat sugar all day, have parents who are stressed out of their minds all the time. I mean, all these other problems that we have in this culture, you've gotta be kidding me if you're going to make a thing about cannabis, if you're going to isolate it and say, this is a big problem. And I always say, if we're really worried about neurodevelopment, then get the kids off the screens. Stop feeding them, hundreds of grams of sugar every day. I mean, a lot of them are getting it in school, So we've got to get our priorities straight. If it really is all about the children, then let's get our priorities straight. But when you talk to political leaders, when you talk to people in positions of power that can make changes, they don't want to hear it. They don't want to hear it.
They sure don't. Well, everyone, thank you so much. Taking time out of your East Coast time day.
No worries. Yeah, my pleasure.
And also thank you to Soul and Sacred Seeds Birthworker Collective and Bree doing the admin. And for everyone else that participated today, we look forward to continuing the conversation and also having you around more, Marissa. So
Yeah.
I'm trying to work that out, figure that out. Also, there's Mahogany Mother Circle, and we meet this Saturday in person at Mama Bird Wellness Center. And we're going to be talking about, we have a special guest that really changed her lifestyle around plant-based lifestyle and has just transformed her life. So we'll have a session with her on Sunday. And then we meet bi-weekly. We meet bi-weekly every other Sunday. Actually, it's every other Sunday. Anyway, I digress. Thank you all so much. Thank you for just, tying up the Black Breastfeeding Week with us, and stay in touch.
You too. Yeah, I'm easily accessible. Thank you so much, Mother. You have a wonderful night.
Thank you. You too. Thank you, everyone. All right. Peace.